I'm Polly Warren and welcome to the Positive Perimenopause Podcast. This is the place for some positive inspiration to help you through the rollercoaster ride of perimenopause. I truly believe that with the right support, knowledge and wellness tools, you can feel your best yet. Because I'm learning this life phase can be a truly exciting and often pivotal time of life. With every episode, my mission is to support and empower you to own your menopause, because it's time to start taking care of the most important person, and yes, that's you. So thank you for being here and sharing your time with me. Now let's dive in. Hello and welcome back to the podcast with me, your host, Polly Warren. I actually feel like I've been away for a long time, although it's been just over a week. But I have been in Ibiza for, I think in total it was about 9 days. But we went over to celebrate my husband's 50th birthday, which he has been planning for such a long time. And it was just absolutely wonderful. We had a few days with our children and then we sent them home, which was quite exciting. We put them on a plane. My eldest, being 17, had to obviously take charge, but it all worked out well. They came home. They had their granny looking after them when they got here. And then my husband and I had a couple of nights, just the two of us, where we cycled across the island and we went kayaking. And then we had 18 of our friends coming out and we stayed in this brilliant villa. And we just had the best time. We just had so much fun, laughing, being silly. We had a great evening of delicious food and everyone wrote a little poem about their memories of my husband, where I basically cried through the lot of it. But the whole thing was just so special. And you just made me remember how important friends are and friendship is. And although a lot of these friends no longer live down the road from us anymore, it's that their friendship is everything. And you just pick up from where you last saw them. So yes, my heart is full and I'm going to dine off that experience for a long time now. And anyway, I am back now and I am very excited for what's ahead in the next couple of months. I'm going to soon be launching my new group program, which I'm so excited to tell you about. I'm going to be doing a workshop too before that. So more details all to follow. Last week's episode, I hope you enjoyed, which was just me talking about my morning routine. So if you're interested in a morning routine, and I promise you it is the best thing in the world, it really does set you up for a great day, you can go back and listen to last week's episode. So on to this week's episode. Now, this week is my first male guest, who is Dr. Ron Eaker. Dr. Eaker is a board-certified obstetrician and gynecologist from Augusta in Georgia in the US. Now, Dr. Eaker has written 3 books, and the last book was called A Woman's Guide to Hormones Health, which is a book on everything menopause. So he really does know his stuff about menopause. Dr. Eaker has also completed 65 marathons and half marathons in 3 different continents. So I had to ask him about that as well, considering that I'm going to be doing a marathon next year. It was really a pleasure to speak to Dr. Eaker. He has a lot of knowledge and experience, which I'm sure you will enjoy. So without further ado, please welcome Dr. Ron Eaker. Dr. Ron, it's such a pleasure to have you on the podcast today. Thank you so much for joining me all the way from Augusta, Georgia.
Thank you, Polly. It's a pleasure. I know that we're going to provide some value to your audience today. I thank you again for giving me this opportunity.
Absolute pleasure. So, Ron, you are the very first male guest we've had on the podcast. So I think today it'll be a really good opportunity to get a different perspective. I mean, firstly, you're an obstetrician and a gynecologist. An obstetrician, for anyone who doesn't know, is a doctor who specialises in pregnancy, childbirth, women's reproduction and the whole of that system. So it always intrigues me, what drives a man to become interested in women's health and in particularly menopause? So perhaps we could start there. So how did you get into it and why?
Sure, that's a great jumping off place, but I think it gives some context to some of the responses and some of the information that I want to get out. Whenever you listen to someone, it's always good to know their contextual background, because I think that helps frame the information and gives you a better understanding. So I appreciate the opportunity. I've been in a practice of obstetrics and gynecology for about 34 years. So back when the earth was cooling, when I was in medical school, I really wanted to focus on a specific area so that I could provide as much value as possible in that niche. And as medical students, we rotate through the different areas of clinical medicine, such as surgery and pediatrics and obstetrics and gynecology. And it just so happened that my first rotation as a medical student was in OBGYN. And I was in a very, very busy medical center where literally we were doing 15 or 20 deliveries a night or a day. And by necessity, many of the medical students were actually hands-on and very involved in births. And I very much dramatically remember the first birth that I actually got to be a part of. And it was transformational. Up until that point, I had become very well versed in what I would call the mechanics of birth. But that experience really restored the idea of the miracle of birth, and it really changed my whole perspective about the direction that I wanted to go. And that was the linchpin. That was the beginning of this interest in not only obstetrics but women's health care in general. So that's where things launched and began. And then as my career progressed, really became very interested in perimenopausal, menopausal women's aging medicine, largely because of a demand from my own patients. As I became older and I had a lot of patients who were aging with me, I began to see a lot of women with a lot of questions and a lot of unanswered questions. And there was a lot of myths and misperceptions surrounding this time frame. And even as recent as 10 or 15 years ago, it was still somewhat of a taboo subject. It was something that wasn't discussed a lot. And there was a lot of frustration on the part of women. So it really, I like to consider myself as still a student, and I'm learning every day from my patients. And it was part of that process that really guided me along the path to learning more about menopause, perimenopause, and aging. And that was in response to their needs. Really, it was not only an interest of mine, but it was such a deficit in what I was seeing in the folks that I was working with on a daily basis that drove me to want to pursue that. Along the way, I also have always been very interested in prevention and wellness. And when I stopped delivering babies about 7 or 8 years ago, it freed me up to pursue some other aspects that naturally tied into menopause and menopausal medicine. And that was looking at things like weight management. I went back and got board certified in bariatric medicine, which is dealing with weight management, weight loss, and all the metabolic associated factors. And as many of your listeners know, that's an intimate, very important part of aging. It's obviously something that many menopausal women struggle with. So there was a natural tie-in there also. So when I think about this arc, I really see it as many times we do in retrospect is these paths just converged, and it really just made sense looking at this time frame in a woman's life and looking at all the different factors that play a role, whether it's hormones or aging or weight or sleep or stress or activity level. So it all kind of coalesced into this idea of really making this time in a woman's life this season the best that it can be. And as you mentioned, it's been interesting as a male in this field. I'll never forget, about 8 or 9 years ago, when I was a much younger person, I was giving a talk to a group of women on menopause. And at the end of the talk, this little lady, she must have been 4'10", and just a sweet grandmotherly type, came walking up to me and says, "Well, Dr. Eaker, I really loved what you were talking about, but you're the wrong age and the wrong sex." And I said, "Well, golly gee, I guess you have a point. I've never quite thought of it that way." But, when I look back, that's been an issue throughout my career, because obviously this is a very gender specific and importantly so, very different than you would look at some other specialties. And it became clear, though, to me as I progressed through this, that really it's certainly not about the gender of the healthcare provider. It's about the knowledge and the compassion and the caring. And it really would, honestly, and I think maybe your audience would agree with me, that there's a lot of men who are very empathetic, and when it comes to healthcare needs, and there's a lot of women who may not be, and vice versa. It's not about gender. It's about the individual and their approach and their ability to partner with you and walk you through and be a part of the process with you. I don't have to experience everything that my patient does. A cardiac surgeon doesn't necessarily have to have had a cardiac bypass to be a good heart surgeon. So in the same respect, I may never have experienced a hot flash, but I have worked with literally hundreds, if not thousands, of women over the last 34 years and helping them navigate those particular problems. And interestingly, too, I think I bring a bit of a perspective that maybe a female physician may not be able to bring, and that's none of these changes happen in isolation. In other words, almost all women in this transition time have someone in their life, whether it's a father, a brother, a spouse, a significant other, that is affected by their transition and the things that they're experiencing. So I can bring a bit of that perspective, understanding that these changes are not in an envelope, that you're not in a isolation when you are dealing with many of the issues related to menopause. So being a male does give me a bit of a different perspective that also has allowed me to sit down and have conversations with spouses and family members that oftentimes can be very, very positive in dealing with some of these issues. I know a lot of women in menopause, some of the biggest stressors is their partner doesn't get it. They don't understand. And being able to relate to those individuals and help guide them along with their wife or significant other, I think that makes a difference. So that's a long answer to a short question, and I hope I answered it appropriately.
Yeah, no, thank you so much. That was a good answer. And actually, it's just about this fact that being a male does give you a different perspective. I think it's really important. I had a message the other day from one of the listeners asking me whether I was going to have any men on the podcast as guests. And I did say, actually, I have one coming up. But she was interested because she said she's been struggling to communicate with her partner about what she's experiencing. And she really felt like she needed some assistance in where to signpost him to get some information about perimenopause, menopause, and so that he could really help support her. And she said that there just really isn't very much out there. There is a real lack of information. So I wonder, I mean, you obviously, you're married, aren't you?
Yes.
And is your wife, is she menopausal, postmenopausal, perimenopausal?
Post.
Okay,
Yes.
so you have
Yes.
experience
I'm
of navigating with your wife. And I don't know,
right.
how did you find that? Did you find that it was easy to navigate with her? Or, I mean, obviously with the job you do, it was obviously very helpful. But I don't know if you have anywhere you could signpost other men to if they were struggling.
Yeah, no, she may have a different perspective on whether I was helpful or not, but I'm hopefully I was. We're both the same age. My wife and I were both 64, so we've been there, done that, and it really does allow us to provide that empathy and that sense of understanding. And in fact, in many times when I go and talk to groups or I teach a course, she'll go with me, and I find it interesting that after the talks, very oftentimes women will come up and question her about a lot of things, even sometimes more than me. So she has very much been a partner with me throughout this as we have lived it ourselves. And I think that's an excellent question. And I think that is something that I learned early on, is that one of the keys for a husband or a spouse or a significant other who is experiencing this with their loved one is to understand, is to be educated. That's always the first step. That is the critical factor. I have found that if a partner even takes a very superficial look at some of the physiology, the understanding, it helps them so much into realizing that these are real changes. Unfortunately, there's been so much misinformation, so much paternalism, and just very, very unfortunate treatment of menopause and menopausal symptoms over the years. It's less now because of awareness, but there's been a lot of misunderstandings, and it's not something that's talked about oftentimes with couples. Very much like intimacy, sometimes is an issue, especially in menopause. But for men in particular, the number one step is awareness and education. And they don't have to get a PhD in women's parts. That's not what this is about. It's about learning the very basics of what goes on and why menopause occurs. Through that understanding, oftentimes it becomes a real decrease in the anxiety and fear of the unknown. Because for many men, that's what it's all about. Here is someone that they are in love with, that they partnered with, that they have navigated many highs and lows over the periods of times. And then all of a sudden, things are different. Things change. Her response to things are different. Her body is different. Her sleep habits, her emotions, those are all not good or bad, but just different. And sometimes different in a relationship can create anxiety and can create misinformation. So number one is education. And in every book I've written, in the course I've put together on menopause, always includes a section or a chapter targeting and specifically for spouses and significant others, written in that perspective, because I understand that that is a critical part of this process. So I make sure that number one, there's that education. And then number two is the communication. And we especially see that when we're dealing with issues of sexuality and the changes that occur in the menopause with regards to sexual functioning. And that is obviously something that very much involves couples. And that's an area where I will constantly harp on the importance of communication. There's no area where there can be more misunderstandings, more imagination that can create problems in a relationship. If a woman has problems, for example, with vaginal dryness, very, very common issue in the menopause, and it creates a lot of discomfort and a lot of pain associated Well, the natural tendency oftentimes is to avoid sexual intimacy if there's pain or decreased sensation or response. But unless that's communicated, then it's very easy for her partner to misunderstand those cues and misunderstand this change in her behavior. And that can manifest in a lot of conflict within the marriage or within the relationship. So again, that communication is key, but it all starts with that education.
It is. It's talking about it and raising awareness. And the more we have that awareness, then we're more likely to be able to talk about it. Because I think a lot of people just find it difficult to talk about because it has been such a taboo subject for so long. But we are on a mission to change all that by doing things like this. And hopefully, just to say to anybody who feels embarrassed or to talk about it, it is the most important thing you can do, because the last thing you want is for your relationship to fall apart because of it.
Sadly. Well, podcasts like this, and that's why I really applaud what you're doing and the effort you're making and the audience that you're reaching, because it is through these types of venues that women are really able to express their concerns, their frustrations, and they're gaining so much insight, and there's so much power in understanding and feeling that you're not alone, and knowing that you're supported, and knowing that there are solutions to the issues you're dealing with. I mean, just knowing that what you're experiencing can be normal. That's one of the biggest concerns I hear every day is, golly, I just am just glad to know I'm not falling apart. I'm just so excited to know that I'm okay. Now, that doesn't mean that I don't have symptoms and there's not problems that need to be addressed, but just the realization that I'm okay, I'm not broken, that this is something that's not going to be the way it is for the next 30 years. That awareness alone is critical. And that's why I love being able to talk to women through this kind of medium, because the service you're doing in that portion alone is incredibly valuable. And I just think it's something that we need more of. The more light we shed on it, the more awareness, the more likely people are to discuss issues related to it. And that's the first step in transformation.
A very quick break to ask you to hit the follow or subscribe button if you haven't already. And if you're enjoying this episode, I'd be super grateful if you could hit those stars and rate it too. Thank you. Yeah, definitely. In fact, the very, very first episode I put out of this podcast, I was talking about my own experience where I thought I was going mad, where I thought I had early onset dementia. And the comments from that episode alone have just been so amazing. But the overriding feeling towards it was like, oh my goodness, it's normal. That's exactly how I feel. I'm not alone. I'm not going mad. And, that every day spurs me on to carry on. And you're so right. It's just that knowing, oh my goodness, I'm not on my own is just so powerful. Okay, so let's move on. So let's talk a little bit about treatments, because from my own Apple podcast statistics, which I can see that half of my audience, amazingly, is based in the US, which I would never have thought, but they do. And I'm always very conscious that a lot of what we talk about on this podcast is UK related, because obviously that's where I'm from and it's where a lot of my guests are from. And particularly in terms of treatments such as HRT, we talk about it in a UK basis. But it feels to me, from the little I do know about the treatments in the US, that it is a bit different. So I'm curious to know from you a little bit more about how you do things over in the US. So what are the recommendations for women in the US when it comes to HRT, hormone replacement therapy?
Yeah, we can start there, because I think that's obviously a very important part of treatment options. And I underline that word and put that in quotation marks. Options really is the cornerstone when I think about addressing symptoms of menopause. So the very first thing I always make sure I say to patients is, this is a normal, natural transition. In fact, the term hormone replacement therapy is a misnomer because we're really not replacing, in the menopause, we're really not replacing something that should be there. The normal hormone levels for a woman after the menopause are very, very low. That's normal. Now, that doesn't mean that that can't arise in a lot of symptoms. Now, on the flip side of that, if you are a 35-year-old woman who has her ovaries removed for whatever reason, or who has chemotherapy and it takes the function of the ovaries away, using hormones in that respect truly is hormone replacement because you are replacing something that naturally should be there. So I think when we talk about using hormones in particular in the menopause, I view that as very much like I would any other medication. It is there to treat symptoms. And the analogy I use with women is that, you wouldn't usually take an aspirin just in case you get a headache. You take it when you have a headache. And I think to a degree, the same thing can apply to hormones. Now, there's some nuances there. And that's the very important part about when we're talking about hormones in use or not use, you can't really make any blanket recommendations because it is so individualized. And there's so many pros and cons based on the individual's history, their current medical situation, what they want to achieve, their goals. So I'm going to be making some statements that are very broad, but just know that each woman is very unique, and making the decision about using hormones or not using hormones really comes down to looking very, very specifically at the individual's particular health history and needs. So in general, I think now we have a fairly good consensus that there is this window where the use of hormones has some beneficial effects with regards to long-term health benefits. When I think of using hormones, I think of dividing it into kind of two categories. Number one is, are there any long-term pros and cons? And then what are the short-term benefits? And the short-term benefits largely are the treatment of menopausal symptoms. Things like hot flashes, vaginal dryness, mood and emotional changes, sleep changes, skin, hair, and nail changes. All those things that many of your listeners will relate to very much. And hormones can be very effective at treating those symptoms. And when I use the term hormones, I'm using that, again, a kind of a blanket terminology to include estrogen, progesterone, possibly even testosterone. And we could spend 2 or 3 hours alone just talking about the hormones. So I'm trying to paint a broad picture just to give folks an idea of how things are in the States. And my guess is there's not that much difference in the UK with regards to how things are approached. But so we look at it, we start from that perspective. Number one, do you have any symptoms? Are you experiencing any particular problems that we need to address? And then number two is, if that's the case, then we start breaking that down into options. Can these be managed through lifestyle? Can these be managed through nutrition, activity, sleep? Are there supplements that are available that can address these particular issues? As a part of that whole spectrum, we do present hormones also. And we make sure that there are no contraindications medically. And we know there are some women that absolutely should not use hormones for a multitude of reasons. But if that's within the spectrum of availability, we discuss the pros and cons. And of course, again, they're always, whenever you're considering any medication, you always weigh it in the scales. I don't care what it is, whether it's a Tylenol or an aspirin or an herbal, there's always pros and cons. So you look at that for each individual. And the advantages of the hormones in particular is they're probably the one we can say that are most efficient at addressing symptoms in a very timely fashion. And let me explain that. Let's just say I had a woman who was having terrible hot flashes, and maybe we wanted to try an herbal or a supplement remedy. And one of my favorites is using a higher dose of vitamin E for hot flashes, for example. Well, that's going to generally take maybe 2 or 3 weeks of consistent use before they may see a benefit from that. And that's very important for them to understand right off the bat. But with hormones, you can pretty well know that within 5 to 7 days, you're going to see in over 90% of people an improvement in the hot flashes. So that's a distinction that I make sure women understand as we're considering this algorithm, as we march down this branching of these ways of approaching these symptoms. And then once we decide that whatever approach they want, then we talk about the short-term and long-term issues. I mentioned earlier that hormones predominantly, when I think of hormones, I think of them as symptom control. But there is this estrogen window, this time frame that the studies have indicated, and we can roughly say that's maybe from 45 to 47 to maybe 55, where if a woman begins the hormones during that time frame, that there is some evidence that there may be some cardiac benefits, a reduction of heart disease later in life. If they begin the hormones in that window, there certainly is some improvement for some women with osteoporosis. There may be even some improvement in cognitive function. Now, the counterbalancing to that is if the hormones are started outside that window, for example, if a woman, say she began hormones for the first time at 60, that dramatically changes that calculation because there's evidence now that actually there may be an increased risk of heart problems and you don't get nearly the prophylactic benefits. So those are all the very complex configurations that one needs to go through when considering that. You know, whenever I think about treating anything in menopause, I think of it kind of in the rungs on a ladder. The first rung is always foundational, and that's lifestyle, that's nutrition, that's activity level, that's sleep, that's stress management. And quite honestly, many women will find resolution to any of the issues they're having simply with those changes. And I know that sounds simple, but that's often very complex. But you always start there because that's where the foundation is built, regardless of what you do after that. If you'll do those foundational changes of the lifestyle issues, you're going to be better off in a multitude of things. And then second, I look at supplements and other alternative approaches, even things like we've seen studies that show that acupuncture and acupressure can help with things like hot flashes. So it's ridiculous to not consider that as options. Anything that has shown validity and empirical evidence in quality studies, I believe should be presented as options. It may not be the appropriate option for that individual, but a woman given enough options and enough knowledge is going to make the best choices for herself. And then the third rung of that ladder is the prescription medicines. And it's not just hormones, by the way. There are a multitude of non-hormonal medicines, some off-label, some on-label, that we utilize to treat specific symptoms of menopause. So hopefully I've given you an overview, but I also think that that's illustrated that this is not a simple process. And very oftentimes it's absolutely vital that you partner with a knowledgeable, compassionate, caring healthcare provider to help walk through this process with you, because there's a lot of nuance.
It's very, very refreshing to hear from a doctor saying that lifestyle comes first. I find that so refreshing because we don't always hear that. I mean, nutrition is, for me, I think is so important to get your nutrition right and to move. And as you say, to get all of that right really makes a massive difference. And I agree, supplements, I think so many of us are nutritionally depleted when we get to midlife, that actually if we can start boosting our nutritional levels, then it all of it really does help with those symptoms. It is slightly different here because here in the UK, if you're over 45 and you were to go to your doctor and you would mention you have menopausal symptoms, the first sort of line of care is to recommend taking HRT. And over here, the kind of HRT we have is the body identical type, which is made from wild yams. And so it is more sustainable. It is cheaper than some of the other forms of HRT. And a lot of it is given through the skin. So you can vary the amount. But I agree with you in that actually, first port of call perhaps is not that. It's more lifestyle. And it's, I'm sure some doctors do talk about lifestyle, and but it doesn't feel like it's the norm. So
yeah, unfortunately, you're exactly, and that's interesting to hear that I would probably agree that would be the most common response in the States also. And there's a number of reasons for that. There's a number of factors. We come from a healthcare system that has developed largely along the symptom treatment mode and not the prevention mode. And of course, we all understand the idea of a pill for every problem. And that really is, I'm hoping, becoming less of the common practice. I think that as physicians and patients in particular, because I truly think this is a patient-driven force in changing healthcare, is that their patients are becoming more and more aware of what can I do to prevent a fire from starting. I don't want to just wait till there's a problem and then have to seek out a treatment. I want to prevent that problem from ever occurring. And the same thing occurs with menopause. There can be some things that women can do early on to even prevent problems with menopause. I think we were talking about exercise. I'm an exercise evangelist. I think that is as close to a fountain of youth as we've ever discovered. And there's a number of studies that say that women who enter into the menopause in good health, and that means women who are active, who are consuming a healthy diet, who actually then go into menopause, oftentimes have much fewer symptoms than women who maybe are not practicing those lifestyles. So that's where that prevention part of it even comes into play, specifically as it relates to menopause symptoms. Women who exercise have many fewer hot flashes on average than women who don't. So that's something that doesn't get talked about a lot, and it's something that every woman in her early 40s that comes into my practice, we have a specific session where we talk about kind of pre-planning for it. It's just like your financial counselor and how you pre-plan for retirement, and how you can't wait till a month before you quit work or go on your pension to think that everything is going to be fine. You have to begin early on and make those plans. Well, the same thing applies to menopause and to longevity in general, is that the changes that you make, the decisions that you make in those early years, and it's really never too early to begin making those changes, can have profound effects on whether you experience symptoms of menopause or aging, because they're so intertwined. Oftentimes we forget the fact, people oftentimes talk about weight gain, for example, in the menopause, and they tend to attribute most of that to hormonal shifts. Well, the reality is the majority of weight gain associated with menopause is aging related, because we know that there are dramatic changes in basic metabolic rate and other metabolic functions with age. Now, some of those are definitely modified by hormonal shifts in menopause, but we never can lose that big picture perspective when it comes to these issues. You can't wear hormonal blinders and think that everything is related to that without looking at other factors.
Yeah, I absolutely agree. I think those first symptoms of menopause are our body's way of giving us a wake-up call. It's kind of saying to us, actually, look, you can't carry on the way you are because something's got to change. This is your sign to change. And for me, that was definitely the case. It was, I was relatively fit and healthy as I went into it, but there were definitely some changes I needed to make. And that was sort of the wake-up call I needed. And I think for so many that it's becoming aware and listening to your body and what it's trying to say to you. And it is about making some changes. You can't just put a sticking plaster over all of it and hope for the best.
This time frame, someone described as where you begin having to pay on all the debts that you accumulated in your younger years.
Yep, and absolutely.
That makes sense.
Yeah, it absolutely does. Just to go back to the hormones, I'm just very curious. What type of hormones do you in the US give to women? Because over here, well, it's not recommended to take anything other than these body identical hormones, which we can get on the NHS, because you don't really know what you're getting otherwise. They're unregulated other hormones. So I'm just really curious to know what the situation is over there.
Yeah, it probably is a bit different because we have a long tradition here of the first hormones that were available in the U.S. were what they're called conjugated estrogens. And the perfect example of that is one called Premarin. And I don't know if that's a term that's familiar to the UK folks or not, but that was a branded hormone that was derived from pregnant mare's urine. And that's where it got its name, actually. And it's a mixture of a multitude of estrogens that are not native to the system. And that was the original and for many, many years, the only hormone that was available. But we now do have, and we call them bioidentical. That's the terminology in the States, but it's, I'm sure, equivalent to your body identical. That is basically the 17-beta estradiol, which is the primary estrogen, the more powerful estrogen that's naturally produced by the ovaries. And that's become, in the last 10 or 15 years, become much more popular and available in the States because it is now commercially available. And, we're a bit different in our insurance and our cost of pharmaceuticals. So it is kind of considered the generic form, which is a much more economical form of the estrogen. So it's not only, in the States, it's not only looking at both the content, whether it's the bioidentical or body identical 17-beta estradiol or the conjugated or what some people refer to as synthetic, but it's also the formulation, how the hormones are getting into the system. And you already alluded to the transdermal, the skin type approach. And in the US, we have a lot of pharmacies, they're called compounding pharmacies, that basically will make up the particular drug in the pharmacy setting and not relying on a particular pharmaceutical company to manufacture it. So there's a lot of flexibility, especially when we talk about creams and gels and topical approaches. So whenever I present this to a woman, I present it in both ways, both in what the content of the estrogen is. And again, my preference is very similar to what you're describing with the bioidentical, because I do believe, although we'll never have a lot of the large, huge studies to prove this, I do believe that there is potentially less in the way of side effects and less in the way of possible long-term complications from using the bioidentical versus the synthetic or conjugated. So that's my go-to, my preference. And then we also talk about the different ways of administering them. We use subdermal pellets. We use transdermal patches. We use oral tablets. We use injections. We even sometimes use oral troches. They're like little lollipops. So there's nothing, there are some subtle pros and cons between the modes of administering. For example, there's some evidence that the transdermals, like the creams and the patches, have a lower incidence of one of the side effects, blood clots that some people associate with hormones. They have an advantage over the oral or the more systemic. You don't get what we call the first pass effect, because when you take something orally, it goes through the liver initially, and that sometimes is responsible for creating the production of certain metabolic byproducts that lead to some of the side effects. And the transdermals don't. You don't see that same first pass hepatic effect. So there are clinical differences in how those hormones are administered. And again, it goes into this complex web of discovering what's going to be best for the individual. And we have access to all those things in the States. And I think probably if I had to just make a broad spectrum estimate, I'd still say that the majority of women are on the oral or the systemic simply because of habit in the U.S. I think the transdermals have made their mark. And I think more and more people are using those, and it very well may be, and I don't have the statistics, but it very well may be they may be approaching equality with the systemic. And I definitely think there's a trend now more towards the bioidentical now that they're commercially available, and many of them are covered by the insurance.
Right. Yeah. No, it's interesting to hear, because it is different. So, yeah, thank you for sharing that. I just want to ask you, because I read that you are a marathon runner. You love your marathons. I just want to ask you this because I've signed up to do my first marathon next year. I've done plenty of half marathons, but I've never done a full marathon, and I'm 50 next year. And I thought, do you know what? I want to do it. I'm going to do it.
100%.
Have you got any tips for me before we finish?
Slow and steady wins the race. I've done 54 marathons.
Wow.
And actually, and I don't know when this will particularly be released, but in about 6 weeks, I'm heading to Scotland for the Loch Ness Marathon that I'll be running in about 6 weeks. So I'm very excited about coming over to the UK and getting a chance to see the beautiful Scottish Highlands and Lowlands.
Oh, it's beautiful up there. It's so beautiful.
I'll be heading there in a few weeks. So the best advice I can give you for marathon training, and this applies to almost any form of exercise, is slow and steady wins the race. You eat an elephant one bite at a time. I think when I first started training for a marathon, I had a very wise coach, and I was very intimidated by the 26.2 miles. And he said, well, you just simply break it up into 10Ks. You've run a 10K, you've run a half, you can do that. So you just think about, as you progress in your training, just gradually increase your long runs. That's going to be the key. You want to build up your weekend long runs by 1 or 2 miles a week, slow and steady, avoiding injury. I've even gotten in my old age where now I'll do kind of a combination walk, run, walk, where I may walk for 30 seconds and then run for 5 minutes, then walk for 20 seconds, then run. And I've actually found my times increase. I've actually sped up doing that. But more than anything else, it's helped me avoid injury, and it's also helped my recovery. My wife used to complain all the time about if I was running a race, it would ruin the next 2 days of our trip because I would be incapacitated. Well, now I don't know if it's just the having done so many and you just get trained, or if it's that style of training. But we'll have after Loch Ness, we'll have a tour the next day because we're not going to waste any of that time waiting on a recovery. So I think that's the key for me is not trying to bite off too much, allow plenty of time leading up to your race, and just gradually incrementally increase your mileage on those long runs. The long runs are the secret. That's the key. Yeah. And I never take it past 20 miles on my training. That's the maximum long run that I ever do. The adrenaline and the excitement of the race will carry you through that extra 6.
Thank you. Okay, so it's a big change for me because I've always been far too competitive and want to run too quickly and push myself. So it really is going to be such a good lesson in really slowing down and just throwing that running watch out the window and not caring about my time, I think.
Yeah, pull yourself back. Don't go. That's the biggest mistake most first-time marathoners make, is they go out way too quick.
Yeah. Amazing. So, Dr. Ron, my very last question I ask all my guests, because this is called the Positive Perimenopause Podcast, can you give the listeners, if you could, just one piece of really practical, actionable advice? What would it be?
Change your attitude. I think it all begins with your belief system. Many women approach this time frame thinking that it's going to be a disaster, believing that it's associated with aging, and we still associate aging with negativity. So I think if I could ask of anyone, begin thinking of this as a new season of life. I love Margaret Mead, the great anthropologist, talked about postmenopausal zest. And I think if you begin to shape your belief system, that is what is the first domino that falls to begin to change every aspect of your life. View this as an exciting time, a time that you can achieve many of the things that maybe you weren't in a position to have achieved before, whether it's in relationships or work or travel or hobbies. So begin to reshape your attitude, your belief system, and everything else follows from that.
Love that. I couldn't agree with you more. Thank you so much today for coming on, sharing your male perspective, giving us your great experience. And it's been really lovely to meet you. Thank you so much.
Thank you, Polly. I appreciate the opportunity.
Pleasure. I really enjoyed speaking to Dr. Ron, and I do think it's really important to get a different perspective, not just from a male point of view, but also from someone coming from a different country, because wherever you live, things are done slightly differently. And I think it's important to bear that in mind. But the most important thing is to make sure you get the knowledge and get the information about what is going on and what is available to you. So if you enjoyed this episode, please feel free to share it with your friends, with anybody you feel might benefit from it. And also, as always, if you would like to leave me a review over on Apple Podcasts, I would be so grateful. And also you could subscribe on Apple and also on Spotify. And if you want to come and tell me any thoughts, please do come and drop me a message. You can get to me on Instagram at PollyWarrenCoaching, or you can send me an email at info@pollywarren.com. That's it for this week, and I really look forward to speaking to you next week. Have a good week. Bye.